doctors. Since I'm one America's Next Top Model, I do a lot of stuff on camera, so my face needs to be flawless. But recently I've noticed a little rash. It started on my hand, but now it's on my moneymaker, my face. So my question to you guys is, do I go to a regular doctor or do I go to a dermatologist?
Well, thanks for joining me today in the Doctor's Medical Center. You just saw model Adrienne Curry's question about a mysterious rash that popped up on her face. She actually went to visit dermatologist Dr. Will Kirby to get some answers.
Adrienne, tell me a little bit what's happening with your skin.
First, I developed a slight rash right here on my knuckle, and it was raised, and it acted a bit like, I guess, poison ivy.
Okay.
Then it started on my face.
And that's where you really get nervous.
Yeah, and it itches. And then, like, I feel little patches of it starting over here.
Okay. By definition, what you have here is perioral dermatitis, because peri meaning around and oral, the oral cavity. So you have a dermatitis around the mouth. That's usually contact dermatitis in nature, or very frequently at least, meaning it's something you've come in contact with.
Yeah. And another thing is I'm slightly allergic to latex.
Okay.
And I find it somewhat suspicious that after a long dental visit where my doctor was resting his gloves on the sides of my mouth, that suddenly...
Great to know. I mean, that certainly could be the cause. So I think what we should do is probably swab it to make sure there's no bacteria there. There's some antibiotic cream and some steroid twice a day applied to that area. And for 3 days, and it should knock it out relatively quickly.
Okay.
Well, Dr. Kirby is back, and you have an update for us on how Adrienne's doing?
Yeah, she's doing great. She actually had contact dermatitis from the latex dental glove that was in contact with her face, and she had secondary impetigo, which means she had a skin infection. But I'm really glad she came in, and I'll tell you why. Approximately 50% of the bacteria that was on her skin was resistant to medication. So we chose an antibiotic that was appropriate, and now she's all clear.
Good to hear she's doing better. Let's head on over here where Sarah is, and Sarah, you're here today for a particular reason. What's that?
I have an ugly tattoo on my neck.
So you're ready for it to be G-O-N-E, gone.
Gone, yeah.
Well, Dr. Kirby, you've seen the tattoo, and you say it's a good candidate for removal.
Sarah's come to the right place. She is a great candidate for removal, and I'll tell you why. It's upper extremity. The neck is very, very vascular. Do you want to have a seat here, Sarah, and we'll take a closer look? And she also has a fair complexion like myself, so black ink tattoos on the upper extremity tend to do really, really well.
And so if anyone's thinking about getting a tattoo and they're not sure they're going to want it forever, you're saying black is actually a good ink to use?
100%. It's not that intuitive, but you should definitely choose black color because that's the easiest for dermatologists to remove.
All right.
So Sarah, you ready?
Yes.
So we're going to get started here on 3. Bear with me 1 second. 1, 2, 3. Here we go. You doing okay there, Sarah?
Yeah.
So bear with me. You're doing great. Now, the clinical frost you see here, that change in color, I'm absolutely thrilled by that. I mean, Sarah is getting nothing short of a phenomenal reaction, and that's actually the lysis of the ink bonds. The ink is carbon-based, and when you see that frosting, we call it, that's actually the breakdown of the bonds. That's carbon dioxide being released.
That.
That's correct. The carbon dioxide gas, it will just dissipate into the environment. We're more than halfway done, Sarah. Bear with me. You're doing wonderfully.
And so this is essentially laser technology. How many treatments would Sarah need for a tattoo like
I'm
this?
glad you asked that question. Sarah's going to need approximately 10. My guess is getting that tattoo took north of an hour, and hopefully getting it removed is going to take less than 2 or 3 minutes. We are almost done, sweetheart. You're doing wonderfully. 5, 4, 3, 2, 1, 0. Sarah, I'm all done torturing you.
I'm applauding you, Sarah, because, you know, I've never had a tattoo removed, but I know those lasers, hey, they do their job by penetrating the skin, and are you doing okay?
Because, yeah, I'm good.
You know, and there's a smell in here of,
yeah.
you know, burnt skin almost.
Yeah, you know what? Actually, what you smell there is probably a little singeing of the hair because this one just went up into the hairline, but the result she has there is exactly what I love to see. See beautiful frosting. You can see the ink dissipated already. She needs multiple treatments, but I think she can rest assured that she's going to have 100% normal skin. So, Dr. Travis, can you hand me that aftercare cream there?
Of course.
Thank you very much. We're going to put just a little bit of this on here, and we're just going to take good care of this after the fact. I always tell my patients 50% of tattoo removal is what I do with the laser, and 50% is how well they take care of it after they leave here today. Sarah's going to be a great patient and do a phenomenal job at home, so I'm extremely confident that she, over the next few weeks to months, she's going to get a great result.
Sarah, you doing okay?
Yeah.
Does it feel a little calmed down now with the cream on there?
Yeah, feels moisturized.
Well, thank you for being such a good patient here today. We really appreciate it. And then also something, Sarah, you may or may not know. You're local, I'm local. You need additional treatments to get rid of it completely, and those are on me. We're going to take care of it. So thank you so much for participating.
You can turn
today.
around, Sarah.
Thank you.
Show everyone at home that you're actually doing okay and you survived. You survived. High five for that. And Dr. Kirby, great job.
Thank you very much.
Thank you, sir. And coming up, women have over a 50% chance of experiencing our next aggravating topic at some point in their lives. But we're going to give you tips to make sure it never happens to you. If you want more information on anything you saw on the show today, including that hammer toe procedure that Dr. Sadre performed, or maybe the tattoo removal with Dr. Kirby, we'll have that on our website, thedoctorstv.com. I really appreciate you all coming today. This was a lot of fun. I think hopefully you all feel like we imparted some wisdom. And, you know, having specialists here is so key to help answer your questions. But I'm going to make my doctor's orders, actually, for primary care docs out there. The most special relationship that almost all of us should have in the world of medicine is with our primary care doctors. You know, those are going to be my doctor's orders. And I just want to thank primary care docs out there for all the care you provide, all the coordination of care. Thank you. Specialists couldn't do what they do without your help. And I want to thank everyone for watching today. We hope you learned something. We'll see you next time.